Welcome to the AWS Education Research Seminar Series. I'm Marcy Collinson, your session correspondent and the Senior Scientific Research Programs Manager for the AWS Research Team. Today, we are delighted to have three presenters speaking about CORD-19 search using machine learning to explore COVID-19 scientific literature. Our first presenter will be Dr. Taha Kass-Hou, who is the Director of Machine Learning and Chief Medical Officer at Amazon Web Services. After Taha, we will hear from Lucy Lu Wang, who is a young investigator at the Allen Institute for Artificial Intelligence, and Kyle Lowe, who is an applied research scientist at the Allen Institute for Artificial Intelligence on the Semantic Scholar research team. We will reserve the last 5 to 10 minutes of the session for a Q&A portion, but please feel free to place any questions that you may have during the presentation in the questions queue on the GoToWebinar toolbar, and we will read them aloud later on. So without further ado, I'll pass the microphone over to Taha. Taha, please take it away.
Thank you very much for the introduction. I'm really glad to be here with you today, talk about a topic where machine learning and artificial intelligence has done quite a bit of advancement in helping the research community. Today, I'm here to talk to you about what we've done in Amazon Web Services to put a solution to address this particular problem as the world today grapples with COVID-19. A lot of researchers and scientists have united in an effort to understand the disease and find ways to detect and treat the infection as quickly as possible. Something that, my entire career haven't seen as I've seen before, where a lot of knowledge being shared from research publications to data sets to documentation. So earlier in the spring this year, as part of the White House Remote Roundtable with tech sector, the Allen Institute for Artificial Intelligence released CORD-19, that's COVID-19 open research dataset. Leveraging this dataset, we built CORD-19 Search. It's a website powered by machine learning that can help researchers quickly and easily find tens of thousands of research papers and documents using natural language questions. This CORD-19 dataset consists of thousands of scholarly articles. Data has been sourced from several channels, such as PubMed, bioRxiv, medRxiv, and others. And the corpus continues to grow. The Allen Institute for AI has done an amazing job and diligently working with the wider research community to help normalize and improve the quality of the data, and also make it available for us to build these search tools to help navigate it. It is multidisciplinary corpus of scientific and research evidence, and the topics include virology, translation medicine, epidemiology, and disease infection, among many others. This body of evidence also on COVID-19 is growing at an exponential scale, so much so that it's been incredibly difficult to digest and analyze. For example, for a human or a researcher to be able to kind of sift through and be able to kind of extract trends or findings. So much that discovering that information has become critical to the development of responses around disease transmission or treatment, or even finding cure or vaccine. So we launched CORD-19 around the springtime, shortly after the data has become available. It's CORD-19.AWS, available to the public, where we help. Our goal is to help you all to be able to navigate this fast-growing body of coronavirus literature and find up-to-date information. Let me walk you through perhaps one example here. Is a researcher might be interested in a specific topic about the severity of COVID-19. So we provide a simple search interface where you can ask that question using natural language questions such as what is the are IL-6 inhibitors key to COVID-19, for example, or when is the salivary viral load highest for COVID-19, or is convalescent plasma therapy a precursor to vaccine? And from the search query, the query will understand the context for your question. The first thing is summarize the body of the most relevant article and bring that to the forefront that way allowing researchers to quickly navigate through the corpus of literature, and also understand the regulatory process. For example, here we're understanding that if IL inhibitor is related to COVID-19, part of that question is trying to understand the severity of COVID-19, and therefore we'll try to find that most relevant information and what is the recent, for example, clinical trials being done on this topic, and then automatically be able to kind of tag the information with the proper tags or concepts. Perhaps I can go a little bit into how we're using various machine learning techniques under the hood on how we build CORD-19. So first, we start with the natural language search. This is highly accurate enterprise search using deep learning that's powered by Amazon Kendra. It's another AWS machine learning service that we offer, a product. This allows you to ask questions, search passages of retrieval and matching, as well as provide the document ranking. This is further enriched by a medical sort of enabled machine learning service called the Amazon Comprehend Medical that extract entity relations within the context and then try to map that to specific medical knowledge, such as custom topic models, and start building the knowledge graph, start feeding into knowledge graph that comes later for the ranking. We have the biomedical topic and concept filtering. So this is where custom topic extraction pipeline trained specifically on COVID-19 scientific article, and then annotated by trained biomedical experts that help user further refine the search results. Then we have the paper recommendation engine. This quantifies and retrieves several similar articles using semantic information captured also by deep learning based language models combined with article topology embedding that learned from the COVID-19 and then structured nicely in a knowledge graph. And lastly is we have the knowledge graph underneath for first to rank this information. So leveraging intelligent graph traversals to refine results using information such as most prolific authors or institutions, or publishing on key topics. So that way the user will be able to sort of sort by best matches or most most relevant authors to that specific topic. We also rank by citation. So paper citation metadata is added to the graph to allow the tracing of results from a paper to future papers that made use of it. The CORD-19 architecture, it's fairly straightforward. CORD-19 search uses various AWS machine learning services that powers the comprehensive and actionable results that we give back to the users. The original data set is enriched first with Amazon Comprehend Medical. This is natural language processing service that uses machine learning where we extract relevant medical information from unstructured text. For example, disease, treatment, and timeline, or relationships, for example, the relationship between a disease and a particular drug or condition and adverse event. And then the data is mapped to clinical models and medical topics as data specific to COVID-19, where we use multi-label classification model and inference, such as we can label a body of literature as virology or immunology or laboratory or clinical trials and so on. And then all those are shown back in the search as options to filter through or to subset the data further, so that way the researcher will be able to kind of find the subset of the data they're looking for that matches best their query. The information is then indexed in Amazon Kendra. This is a highly accurate enterprise search service powered by machine learning also. That deliver robust natural language query capability that really makes it easier to find ranked related articles without having to sort of specifically be bound by specific queries. So really allow the user the freedom and flexibility to ask the questions. So where we can understand the intent and be able then to surface back the results. All this is made available from the Allen Institute CORD-19 data that we also surface on the public AWS COVID data lake, so anyone can be experimented with and analyze that curated body of data. Let's look at a few examples here. I mean, for example, the end result as you put all these pieces together. If you ask a question, for example, what are prevalent antibodies in saliva? The answer that comes back, really try to connect the dots for the user. First, or the researcher, first we bring up the top matching query based on our understanding of that query, summarized, and then try to start connecting the dots. For example, the answer will provide evidence that immunity with COVID-19 mimics other respiratory illnesses like influenza or SARS, and then start pointing to the mechanism of action about finding that antibodies. For example, B cells are present in the salivary glands and produce IgA or immunoglobulin A for asymptomatic or mild infections. And then related articles will be also present on biomarkers for those that would that indicate the severity of disease where the immune system takes a step too far. Therefore, you find evidence about other articles talking about damaging lungs and organs with elevated levels of IL-6. So here we started with a query asking specifically about about antibodies, and then the query results came back with when you can find what type of, for example, antibodies you'll be able to find in saliva, but also connected the dots with the severity of the illness as well as with other biomarkers about how the immunity kind of works. We have some query examples here on the slide, some article top matches articles, but you can also see in the responses how we don't just present back the abstract, but we actually summarize the information, what is the best match in that whole article for the researcher to be able to further navigate. And this really makes it a lot easier for researchers to kind of, with a quick glance, understand that, this is really matched my query, and now I'm going to further refine it with the other filters, whether by topic or whether by keyword or best matching or even by date. So let's get a little deeper into the knowledge graph. So once we process information, how we structure the unstructured data, we build the topics, we then surface the natural index the information and serve a really stellar sort of natural language understanding query experience. There's a knowledge graph that organizes all this information in a way that can really help connect even more dots, for example, citations, or be able to find relevant articles or relevant research, not just from the COVID-19. Some of the CORD-19 data sets go back at least 10, 15, 20 years, covering SARS and MERS and other things, or other clinical trials being done on animals and whatnot, and how we find that all that information has quite a bit of relevance to the actual query that the researcher is going after. So under the hood, we have for the knowledge graph reference in this architecture. There's machine learning, a component where we generate embeddings from the titles and abstracts on each paper, where we use Cybert for that. But then we make the embeddings on paper notes based on the topology of the graph, because topics and concepts link papers together. And for that, we use DGL, KE, or Trans-E. These are extracted from every paper using a custom model, so topics, as well as comprehend medical's built-in model. Or those are the concepts such as disease or condition or medication, and all the entities and the relations among those. Papers that have edges with common concepts will likely have their graph embedding close to one another. And then the graph embedding, therefore, it transcends more textual similarity that we surface back as part of the search and relations to every article that we return. Embeddings are then combined to calculate also a semantic similarity value between the papers, represented by the weight of the edge connecting these papers. And this sets the foundation for our recommendation system. For the user experience, we have ranking. So we allow the user to rank by author institution or by citation. To just give that flexibility to sort based on those. For example, on the author institution, most prolific author by starting with a paper node, finding the nearest author node, that's the paper's authors, the paper's authors, and then finding how many other paper nodes that are attached to it will be present. And the same algorithm can be used also for institutions. We also have a citation rank. This is where we extract citation from every paper. And if a citation was also found in a paper in a data set, then we create an edge between those two papers. This creates a citation network. And then if a researcher finds a paper of interest using CORD-19.AWS, then we present them with a cited by section specific to that to find all the relevant information from other COVID research, as well as from nearby sort of other pandemics or outbreaks such as MERS or SARS or Ebola and so on. The knowledge graph architecture from the text side is built using Neptune, and the CORD-19 data sets and the annotation from Comprehend Medical is all sort of embedded there. And then we use Gremlin, this is the graph query language, just to be able to allow the, an easy way to query the graph and exercise the features that we created in all the prior steps. AWS, we're really committed to applying machine learning to advancing science and healthcare, where we believe machine learning has a great value in bridging a lot of gaps in this particular instance, in how we can really bridge the gap in research and science and enable scientists to really advance their work and accelerate the pace of discovery, where we believe the speed of COVID-19 disease intervention and progression and treatment is really critical. And with this body of evidence that the Allen Institute has made available, has been really incredible. Our long-term vision also is to build future capabilities based on this kind of CORD-19 search architecture, what we made available to everyone out there to search, to be able to integrate disparate data sources beyond the CORD-19. This includes clinical research data, documentation, allow researchers around the world to really be able to aggregate patient-specific patterns of disease progression, be able to provide data-driven decisions, and ultimately positively impact the patient outcome at scale. With that, I thank you so much for your time today, and I'll pass it on now to Lucy to continue on the discussion. Lucy, back to you.
Hi, everyone. It's really a pleasure for us to be here. I'd like to thank Taha and the rest of the team here at AWS Educate for inviting us here to speak. And we're very excited to talk to you today about the COVID-19 Open Research Dataset, or the CORD-19 dataset, which Taha has just introduced in his talk. My name is Lucy Lu Wang, and I'm here today with my colleague Kyle Lowe. And we're both researchers on the Semantic Scholar research team at the Allen Institute for AI, or AI2, which is here in Seattle, Washington. And we both worked extensively on the creation of the CORD-19 corpus. So in the first half of this talk, I will discuss some of the motivations we have around creating this corpus, this data set, as well as some of our design decisions. I'll present some of the recent updates to the data set. And then following that, I'll turn it over to Kyle, who's going to discuss a bit about how folks in the community have been using the data set, as well as some of the remaining challenges we see for it going forward. And Dr. Kass-Hou has just wrapped up a discussion of the AWS Comprehend Medical CORD-19 search tool, CORD-19.AWS. And that's a system that's indexed and provides search functionalities over the corpus. So we encourage people to go and test that out and see some of the data in this data set for yourselves. So first of all, just a little bit about our team at AI2. So Semantic Scholar is an open academic literature search engine that was started in 2015. and it now indexes more than 185 million scientific papers. So this team that we're on primarily focuses on creating AI-powered tools for scientific discovery. So things that support paper reading, writing, understanding, search, and so on. And for these purposes, we release a number of open source tools and data sets to assist in these mostly natural language processing use cases and applications. So we release things like pre-trained language models, recommendation engines, different NLP libraries, and so on. So the creation of CORD-19 kind of falls under this umbrella of some of the things that we excel in. And it takes advantage of the fact that we already have a lot of systems in place for indexing papers and for cleaning up their content as well as their metadata. So to start, of course, the COVID-19 scientific literature is being published very quickly. There's been more than 40,000 new papers and preprints published in this year alone, in 2020, most of which has been in the last 4 months. And if you do the math, this amounts to several hundred new papers every single day. So to manage information overload, it's very clear that we need automated methods to support researchers and scientists in order to handle this volume of papers and preprints. And this is the primary motivation that we have for creating the CORD-19 dataset. So CORD-19 is a dataset of machine-readable COVID-19 related research. And the idea is to gather both historic and newly published literature in one place. And we also provide clean metadata and the full text of those papers so that the community can then focus on building tools for search, for extraction, for summarization of knowledge, and so on. And this should then in turn relieve some of the burden on researchers who are reading these papers. So we released the first iteration of the dataset on March 16th. At the recommendation of the White House Office of Science and Technology Policy. And we actually only had 6 days to turn around the first iteration of the dataset. And since then, we've expanded the dataset to include more than 195,000 papers. And we have full text coverage for a bit less than half of those, around 85,000. And CORD-19 combines articles from a variety of different sources, such as the World Health Organization's COVID-19 literature database, PubMed Central, PubMed, and various preprint servers like bioRxiv, medRxiv, and archive.org. So these papers and preprints are now primarily ingested through the Semantic Scholar search engine. And every single time we release a version of CORD-19, we provide some cleaned, harmonized metadata for these papers, as well as this parsed full text of these PDFs and other full text representations that are available to us. And we mostly optimize for presenting open access full text. We cannot release papers that are not open access. Also, since May 12th, in collaboration with IBM Research, we've incorporated the HTML parses of some of the tables that have been extracted from these PDFs. So this was done in response to lots of user requests. The top request we received by far was for these tables, since a lot of the numeric information that people wanted to extract using machine learning methods actually lived in these tables, and these were not included in the original full text parses. So for example, if people are, say, looking for odds ratios or confidence intervals that support a particular hypothesis, like how effective a drug is at treating coronavirus. These numbers are rarely mentioned directly in the text, but can often be found in these tables. And here's an example of what a table parse looks like. The table from the PDF, the image of the table is shown on the left here, and the corresponding HTML parse is on the right, and it preserves the columns and rows. So these are available for around 25,000 of the documents in CORD-19 right now, and we're working to improve coverage. So you may be wondering, what exactly does the data in CORD-19 look like? So in some sense, this isn't a traditional data set with a lot of numbers and attributes. Rather, it's a corpus of scientific papers. So most of the data is textual, and along with some of the associated metadata of these papers. And the point of the corpus is to support machine learning, so to support the application of natural language processing techniques, NLP techniques, as well as various text mining techniques. And the metadata is tabular. This part is maybe more traditional in terms of a data set. So here's what a part of a metadata entry looks like. It contains traditional paper metadata fields like titles, authors, publication dates, and so on. And we also include a unique identifier, the CORD-UID, to help identify these documents. And whenever full text is available, we provide a link between the metadata entry in CORD-19 and the JSON parse that we generate from the paper's PDF. And a snippet of that JSON is shown in this box right here. And this conversion of PDF documents to JSON documents is essentially how Kyle and I got involved in the project in the first place, because it takes advantage of this custom PDF to JSON parser that we created as part of the STORK project, which you're welcome to read more about in our recent ACL paper this year. Similarly, in that JSON parse, you'll also find the tables, the HTML table parses. So highlighted in red is the beginning of a HTML table. So that image on the right is converted into the structured format, which can then be mined for information. So this is kind of what the data looks like. But why did we choose this format? So let me try to provide a little bit of context. For natural language processing applications, we really need clean text. We need the text to be in order, but without a lot of kind of noise. But it's actually quite hard to get clean text out of scientific papers. The primary distribution format for scientific papers is PDF, which is designed for kind of faithful visual representation. And it's very difficult to extract all of the structure components, the text, out of a PDF without kind of mangling some parts of it in the process. And there's been many tools out there kind of created to kind of extract information from PDFs, but it's always kind of an imperfect process. So folks in academic publishing have realized this, and many of them have also coalesced around different XML formats for representing papers. And there's two more very notable standards, TEI XML and JATS XML. These are both standards for representing scientific papers. However, though these are standards, they're not really consistent definitions for how to represent papers, which tags include or exclude, and also what they mean. So essentially, each publisher that publishes their works in these XML formats kind of adheres to their own interpretation of these schemas, which can make it challenging for downstream use. And lastly, there's works out there that are published in HTML, or some of which we can have the LaTeX source for. So these are some other potential paper formats that we're dealing with. All of these file formats mix typesetting or visual representation information with the content of the papers. And it makes it very difficult to disentangle and extract just the semantic information out of these papers. And what I mean by semantic information is the titles and authors, the full text of the papers in order, figures and tables, the bibliography references, as well as various relationships between these objects. So it's very hard to get at these. And additionally, some of these XML or other kind of tagged formats don't really support overlapping span annotations, which are very important for NLP. I think Taha mentioned kind of annotating entities and relationships, these are slightly harder to do. So for STORK, we tried to create a fairly minimal JSON format for representing these papers. And the STORK JSON supports most of these natural language processing use cases while still kind of faithfully representing the important structured information about a paper. And is this file format that we use in CORD-19. So as I mentioned, STORK JSON was designed for NLP to support NLP uses and annotations. The text itself is very minimally structured, and we preserve only things like paragraph breaks and section headers. So here's just a snippet of text in that JSON, what it looks like. Then additional annotations can be made on top of this text. So the most basic annotations one can make are to things like sentences or token boundaries. But one can also annotate things that are much more specific to scientific papers. So for example, we provide natively in CORD-19 annotations of inline citation spans within this text. So here, the parentheses to close parentheses is a reference to this bibliography entry. And we detect and annotate the span and link it to the bibliography entry in the reference section of the same paper. And that bibliography entry can then be resolved to another paper in the citation network. And that's shown on the right here, this risk factors paper. And we also provide some native annotations to figure and table objects as well. So one can also annotate entities, as I mentioned before. So for example, hypertension and ARDS are both phenotypes that are associated with COVID-19. And one can link these to entity identifiers from other databases or to other terminologies. So for example, I've provided an example of linking the term hypertension to the mesh term, its corresponding mesh term. And if you're interested in clinical information, you could also link to a knowledge base like ICD-10. So some folks have already done this kind of work on papers in CORD-19. And there's, of course, many other things one could imagine annotating, things like equations, footnotes, URLs, or classification labels. For example, one could provide PICO labels or result labels if you're working with clinical trials. And the vision here is that by providing a standardized JSON parse for the papers in CORD-19, then researchers in the community can create these various layers of annotations, sometimes generated through fairly expensive manual efforts, and share these annotations so that other folks can use them. So, for example, if I'm interested in working with clinical trials and systematic reviews, I may find the mesh identifiers and the PICO annotations more useful. I can load those in and use those as inputs into my machine learning system. So there's a couple platforms out there that support this kind of public sharing of annotations. Just wanted to point those out. Here's a couple of examples of reusable annotations that we found on the CORD-19 dataset. At the top there is a couple examples from Pub Annotation. You can see some annotations to entities from a few biomedical ontologies, the Monarch ontologies, human phenotype ontology, Mondo, which is a disease ontology, and Uberon, which is an anatomy ontology. And then below that, you'll see a link to PubTator, and PubTator provides annotations to 6 biomedical entity types like genes and proteins, drugs, diseases, cell types, and so on. And I believe AWS Comprehend Medical also has a knowledge base, which provides biomedical entity types. So in short, hope I've given a reasonable summary of the CORD-19 dataset, but we've identified and implemented a set of key features in CORD-19, which we hope are able to support a variety of use cases. So the dataset is fairly comprehensive, and we do this by including papers and preprints from a variety of different sources. It stays up to date, and in fact, we release daily updates to the dataset. As I mentioned before, there are hundreds of papers that are newly published each day, so it's very important to be up to date. We provide clean metadata with some minimal harmonization and deduplication efforts, and for each paper in CORD, we try to provide clear provenance, where we derived it from, the source, as well as the license information associated with that paper. And finally, we enable text mining on the corpus by providing this structured body text as well as table parses. So then what are the remaining challenges here? Well, first, as I alluded to before, we could really use an easier way to derive structured representations of scientific papers. I hope I've convinced you that PDF is a challenging document type to work with. There's some structured alternatives like XML or JSON, which might be better for text mining and machine learning applications. We've developed a pipeline for converting PDFs to JSON through Stork, but the pipeline will never be perfect, and it would be easier if we all started with something a little bit more structured. So second, securing open access rights to COVID-19 publications has been a continued challenge. Though many major publishers have collaborated with PubMed Central to make their papers available, we've also noticed here that more than half of the papers in CORD-19 are papers where we don't actually have a license to republish. And this includes some of the biggest publishers like JAMA. And third, there is no standard schema for representing paper metadata, making it fairly difficult to create a data set like CORD-19 by combining articles from different sources. And it'd be good to adopt a standard, for example, like the JATS XML tags. However, some of these standards are still open for interpretation, and they might also not be complete or suitable for describing all of the types of publications that we're seeing today, which in addition to journal articles include things like conference proceedings as well as preprints. And we haven't quite figured out kind of best practices for representing those publications. And finally, a question that's come up several times during data set development is, what exactly is a COVID-19 related paper? That is, what should be in CORD-19? We use a very simple set of keywords, 6 or 7 keywords, to try to capture most of the papers that reference coronavirus and COVID-19. And this already results in about 195,000 papers, which is pretty big. But what about other papers that could be relevant to discovery? What about papers in domains outside of biomedicine, or papers on a related disease but contain mentions of a drug that could actually be repurposed to treat COVID-19? And also, what about the papers that are cited by the papers in CORD-19, but not actually in CORD-19 itself? How do we decide which ones to include in the data set? And that's one of the questions that Kyle and I and some colleagues are working to answer now. I also want to say here that it's possible that the STORC corpus could be used for answering these questions. So I mentioned before the STORC pipeline for converting PDF, but in addition to that pipeline, we actually also released a data set of papers in the STORC format. And that data set consists of 136 million papers and about 13 million full text. So a lot bigger than CORD-19. And you can think of STORC as essentially an extended version of CORD-19 that covers the entire literature graph. So many other fields of study, many other subjects besides COVID-19. So those who are, have been working with the CORD-19 format but are looking to expand beyond the direct scope of CORD-19 can potentially use STORC as an additional source of paper data. So looking ahead for the data set, the things that we're thinking about now, there's, of course, always opportunities to make content improvements, and this includes just deriving papers from more sources. For example, papers in other domains, papers that aren't open access to us now, possibly foreign language papers. But probably more so than before, we're concerned with the kind of long-term support and stability of the data set. And so this involves making more quality improvements rather than quantity improvements. Lastly, we're thinking about kind of how best to support these downstream applications, applications like CORD-19 AWS search and others. So now it's a perfect time to switch gears to applications. With all of these features, the data set's aiming to support text mining and information retrieval over the literature, but so that when given a clinically relevant query like this, does hypertension increase the risk associated with COVID-19, or the example that Taha gave about IL-6 inhibitors. So given these queries, we want systems that can combine retrieval and extractive machine learning methods over the CORD-19 corpus to identify answers. And not only to identify these answers, but then to summarize these answers across the whole corpus so that clinicians and public health officials can more quickly make decisions. And of course, as things change, as new papers are published, as the landscape around the pandemic changes, we also want these systems to be able to adapt to kind of the current state of knowledge. So CORD-19 provides the data set, but ultimately we need systems to be built on top of this data to allow users to interact with these documents. And so in the next part of the talk, Kyle is going to discuss some of the systems that have been built on top of CORD-19, what we've learned through the building of these systems, as well as some of the shared task infrastructure that have been created to evaluate these systems. So I'm going to let Kyle take over. Okay.
Right, does everyone see?
Yep, looks great.
Awesome. All right, so thanks, Lucy. And In this part of the talk, I'm going to be talking about how CORD-19 is currently being used. CORD-19 has been adopted for a wide range of downstream research, and in the past couple months, we've started seeing the results of some of these projects. On the medical and clinical side, most of the work has used CORD-19 to conduct systematic reviews, answering key scientific questions, such as identifying at-risk populations or identifying potential drugs for repurposing. They do this by applying text mining techniques to identify which papers within the CORD-19 are relevant to their study and using the metadata we provided to access the original papers. These text mining techniques can range from very simple Boolean queries to pretty specialized information extraction models. Of course, most of the adoption of CORD-19 has come from the NLP and text mining community, with the goal of building tools that can help biomedical researchers make sense of the rapid publication around COVID-19. Lucy and I have been collecting information on these projects. If we just look at projects that have resulted in some sort of deployed publicly available system, we know of over 50 of such systems, and that's a lot. And that's not even including projects that are still in the works or have resulted in other community contributions, such as modeling resources, annotated datasets, or constructed knowledge graphs. The table here shows different focuses of the earliest systems, which were deployed within maybe a few weeks of the initial CORD-19 release. It's especially important to get useful systems up and running early on in an epidemic when information need is very urgent. And we've noticed the most successful projects are those by groups who have invested substantial effort into related projects long before the current epidemic. Comprehend Medical, as Taha described earlier, is a great example of this. We can also view the current epidemic as sort of a test of whether groups are capable of building useful tools very quickly, and also whether the machine learning and NLP can actually substantially improve the work of biomedical researchers. From the 50 or so systems, we have seen demonstration that groups can clearly deploy applications very rapidly, but how useful are they? Evaluation of these systems is very difficult because they require biomedical expertise, which is pretty costly to obtain. Shared tasks and competitions are actually a great way of pooling resources to simultaneously and efficiently evaluate many different systems on a level playing field. So here are some that we wanted to highlight that we know are organized around CORD-19. Collectively, they cover tasks like information extraction, information retrieval, question answering, and summarization. Today, I'll focus discussion on two of the earliest organized competitions and how they've been tailored to support the development of useful machine learning tools and systems. These are the information extracting task organized by Kaggle and the document retrieval task that will be part of Trek 2020. Round one of the Kaggle challenge for information extraction began in March, sometime basically along with the initial release of CORD-19. The task involves participants are given a question like, what are the primary risk factors for COVID-19? And then they use text mining techniques to extract answers from all the papers in CORD-19. These extractions can be pretty much anything, entities, sentences, tables, or full paragraphs even, such as the one shown above here. Recruited medical experts then assess these extractions in terms of their relevance, how comprehensive they are, how useful they are, how easy they are to consume. Round one completed for the Kaggle challenge with over 500 participating teams, making it one of the most popular Kaggle challenges ever, and showing how much the computing community has really tried to get involved into the effort. Of course, with so many participating teams, this meant that manual evaluation by experts was extremely costly. Medical experts had to read through bulk quantities of these lengthy text extractions and compare quality between different systems, which was extremely difficult. And what's interesting is that motivated by this, we see some spin-off projects. So one such project was motivated by this unwieldiness of the unstructured text extractions. And what they focused on was they wanted to organize these text extractions into tables of scientific findings to impose more structure onto the output. So what we have right here is an example output from that project. Let's again consider the same question of, say, diabetes as a risk factor. The rows correspond to individual papers and their metadata is provided here. And the types of questions, types of answers to question are represented in these columns. So for example, we can see this odds ratios for severity and fatality. And we can also see that the answer is not complete with just these odds ratio. You also want information about the study, such as the number of subjects and their population. These table schemas are specific to each such question that's being asked. So the table about risk factors might look different from the table about testing or drug repurposing. There's been a significant interest by the medical community in the output of this project. And these tables have been adopted as the output format for round 2 of the Kaggle competition. So what we can see here is how the Kaggle organizers have learned more about the informational needs of medical experts and adjusted their task and evaluation to better align with those requirements. Pivoting to the Trek COVID share task, this is a task focused on document retrieval rather than extraction. It's organized by AI2 in collaboration with other institutes like NIST, OHSU, UT Health, and the NLM. In this task, given a question like, how long does coronavirus live on surfaces? We want systems to rank papers from CORD-19 from most to least relevant. These rankings are then compared to gold rankings provided by medical experts. And at first glance, this might seem like your standard retrieval task. But Trek COVID tries to do something a little different, tries to build in some real world challenges motivated by the current epidemic. In particular, we want to see if participants can build working systems very quickly and adapt to constantly changing conditions over time. As such, we've organized the competition into multiple rounds with 1-week submission periods to really test how quickly people can turn these predictions around. Also, each round corresponds to some fixed state of the CORD-19 corpus, which is constantly changing, adding new papers or papers are changing. And we also add new, more relevant questions over time. Finally, past relevance annotations may no longer actually be valid for papers that change between the rounds, such as preprints can get updated between rounds, or a paper that we originally only had metadata access to maybe suddenly gained open access full text at a later date and its relevance actually changed. So these are all real challenges that we try to build into Trek COVID. In addition, the questions that we're using are curated from real information-seeking queries issued on Medline, and therefore we can see how they've evolved over the course of the current epidemic. For example, we see in round 1 at the end of March that people were asking where the virus came from, how does it spread, what are the symptoms? At the end of round 3 in May, queries were instead about virus mutation and long-term effects of having COVID-19. And finally, in round 5 in July, queries are now about vaccines and guidance for management policies, such as those regarding social distancing. In summary, we can see how Trek COVID is taking a familiar document retrieval task structure and adapting it to capture known challenges that manifested during the course of the epidemic, so that systems are actually being evaluated on their real-world applicability. Finally, we draw attention to a correspondence between the goals of these tasks and the steps in the systematic review process that successful systems could help improve. Systematic reviews are a very familiar way by which medical experts synthesize evidence from the vast body of scientific findings to be able to make effective decisions and policy recommendations. An outline of the process is shown here. Yet, a proper systematic review can take months or even years to complete, which is much too long if we're trying to rapidly answer key questions about an urgent public health crisis. Despite this, the process around systematic reviews is very well established and has been successfully used over the past few decades. So what we'd like to see more of is application of machine learning to improving this effective process. Systems performing information retrieval and information extraction are familiar to us, and it's easy for us to conceptualize how they can improve systematic reviews. But what we'd really like to encourage is both system developers and competition organizers to consider tackling areas in this pipeline that are still underexplored. In summary, the current epidemic has shown us how important it is to invest in NLP and text mining for biomedicine so that we are better positioned to handle urgent information needs during such crises when they occur. What we've learned from observing many COVID-19 related projects and organizing these shared tasks and competitions is that systems developed under traditional setups likely produce difficult to consume output, like we saw in Kaggle round 1, or fail to address real world challenges that we tried to preserve in Trek COVID. Better alignment between the computing and medical communities is critical to producing useful tools and systems, as we saw in the pivot to Kaggle round 2. And we hope to see more ways of executing on this, maybe through innovation within the systematic review framework. In closing, we'd like to thank our many collaborators on CORD-19 and the related shared tasks. This project started out as a rapid scramble to repurpose some parts of Stork and has grown to involve a lot of people and support a lot of downstream projects. We've included links to download CORD-19 or Stork above. Our paper on CORD-19 is also available on archive and contains more details about the data sets, what people are working on, and our thoughts looking forward. Feel free to reach out to us via email or Twitter, and this concludes our talk. Thanks.
Fantastic. Thank you guys so much. You all did a wonderful job, and we do have some questions in the queue from the audience, so I'm going to dive right into those. Our first question is, how would you differentiate CORD-19 from reference citation managers such as Mendeley and RefWorks? And if I decide to use CORD-19, will I still need RefWorks, Mendeley, or other reference managers?
I can go ahead and try to tackle that. I think the role of these reference managers is really key for managing papers about a certain topic. I think there's maybe a little bit of overlap in intention, which is for CORD-19, we're trying to create a set of papers that are relevant to a particular topic, in this case, coronaviruses and COVID-19. So that part is kind of a shared feature of both CORD-19 and these reference managers. But ultimately, we're trying to create a corpus to support text mining and NLP. And the important part of that is not just the metadata management, but actually also creating full text representations of these papers so that people can dive into the text, find snippets that answer particular questions, find result like values from the full text that support a particular hypothesis and so on. So that full text representation is something that the reference manager simply cannot handle. So a reference manager, you might be able to attach a PDF document to the metadata entry, the paper entry, but you cannot easily extract text or useful text out of the PDFs.
Wonderful, thanks, Lucy. I think this next question is in reference to Taha's presentation. Is the knowledge graph based on existing ontologies? If yes, could you share with us which ontologies or medical vocabularies are useful for creating this knowledge graph? Loink seems to be well updated for this task. Is Loink one of them?
So thank you for the question. So there's Loink, ICD-10. We saw also from Lucy a few others. So part of the process that comprehend medical underpinning. This is the medical sort of aware machine learning service that Amazon Web Services offer. Extract the entities and map them to the appropriate results. So this could be condition, diseases, or it could be laboratory results, or it could be medication. So RxNorm is another one that we follow, and then all the additional entities that can stem from that. For example, the dosage, the route, the frequencies, and then over time, how you'd be able to kind of keep track of those. In addition to how these entities kind of relate to one another. So all that is embedded within the Amazon Comprehend Medical, and it's resurfaced back in the knowledge graph. So that way we allow you to kind of, as you search with natural language understanding, using just natural queries, we'll be able to organize by topics or by concept.
Great, thanks, Taha. So next question is, how do you resolve contradicting information?
Who is this?
A little bit vague. But,
I'm sorry, is this to Taha or is this for CORD-19?
I think it's open forum. So I think it's related to CORD-19, if I had to guess.
Maybe we can both answer it, Taha.
Yeah.
I guess contradiction, Kyle, I guess I'm interpreting that as if there's two papers from different sources with contradicting information.
Right. Yeah.
Yeah, so we do see this. For example, a paper can come from a preprint server and then also subsequently from PubMed or from the WHO database, and they can have mostly overlapping information, say like the same DOI number or some of the other identifiers. But then the title might be slightly different, or the author list might be slightly different, the publication date probably different as well. And what we do is we actually, we try to preserve links to all of the sources that we have. So when we merge those entries, we identify those entries as being the same, and we merge them together into one entry in CORD-19. And then we preserve all the sources and URLs from which we derive that information. But then we do pick a canonical metadata representation from among the sources. And we essentially do this by prioritizing the sources that we trust more over those that we trust slightly less. So in this case, PubMed Central, we would prioritize over the preprint servers.
Great. The asker actually added some clarifying information. They said it was pointed towards Taha, and specifically, here we go. How do you resolve contradicting information when answering questions about same topics such as COVID-19 infection rate?
Yeah, I mean, so I mean, this is a challenge, honestly, we have seen, because the understanding also of the pandemic is evolving quite a bit. So many of the models, machine learning models that we built, learn from this data. So, and this is honestly why we sort of went into the ranking sort of feature, and why we introduced the knowledge graph, is to be able to start picking at those relevance scores, and even some of the curation that goes into those. I mean, this is a challenge that we will have regardless, but it's something to honestly to embrace, because the world is learning about the underpinning about how this disease can propagate in the community, whereas the infection rate, immunity rate, the latency periods, and that sort of thing. So as more evidence sort of pile up, is we're keeping track of that, and then the way we surface it back again is through the knowledge graph with the relevancy score, and rely quite a bit also on the metadata, as Lucy mentioned.
Great. I'll just do one more, and then we'll have to close the session out. So the last question we'll go for is, are there efforts as part of this project to incorporate imaging data such as CT scans of patients with COVID-19?
Ooh. I think that's CORD-19 question, it sounds like, or maybe both also. So images we are actually looking into, at least for Stork, and so it would propagate into CORD-19, how to better incorporate images extracted from papers, and also release that. But there are some trickiness around it, particularly that licensing of images within papers can be licensed differently from the paper itself. So that's something that we're thinking about, but it's not like in the short term.
Wonderful. Okay, great. Well, thanks again to Lucy, Kyle, and Taha for such a wonderful presentation. I did want to let our audience know that we will have another session coming up next month. You can register on our homepage, which I put a link in the chat to. Our next session will be about NIH Strides Biomedical Research in the Cloud. STRIDES stands for Science and Technology Research Infrastructure for Discovery, Experimentation, and Sustainability. And this session will have 3 separate presentations by representatives of the National Institutes of Health, AWS, and 4 Points Technology, and will be on August 26th from 9 o'clock to 10 o'clock a.m. Pacific Standard Time. Thank you to everybody for joining. We appreciate your support and look forward to seeing you again. Have a wonderful day.